Let's talk about Felty syndrome. So, where does it happen? Felty syndrome is a complication of patients with rheumatoid arthritis. So, the patients who have rheumatoid arthritis for a long time, obviously those patients are older, and usually those patients are female. So, a female older patients who had long-term rheumatoid arthritis, and this has resulted in deformity, obviously along with a positive rheumatoid factor. So those are the risk factors for Felty syndrome. An older female patient who has had long-term rheumatoid arthritis that has resulted in deformity, and she also has positive rheumatoid factor, are the risk factors for development of the Felty syndrome. So those are the risk factors. This patient will get Felty syndrome. Next, let's talk about the features. What are the features of the Felty syndrome? So the basic background is the hyperactivity of the reticuloendothelial system. So if there is hyperactivity and proliferation, you will have lymphadenopathy, you will have large spleen or splenomegaly. And obviously, along with those, you will have other features of rheumatoid arthritis, such as vasculitis. And obviously, if there is vasculitis, there will be increased chance of leg ulcer. There will also be some subcutaneous nodules. And as there is hypersplenism and decrease in the cell count, especially decrease in the WBC count due to hypersplenism, there will be increased risk of infection. So there will be recurrent infections. So those are the kind of features, clinical features that you'll find in the patient. And if we dive deeper, if we do investigations in this patient, what will be the investigation findings? First of all, as the patient has hypersplenism, overactivity of the reticuloendothelial system, the spleen will engulf the cells. So what happens? Decrease in all cell counts. So decrease in the RBC count, decrease in WBC count, especially the decrease in neutrophil count, and decrease in platelet count. So the patient will have kind of like pancytopenia. And along with this, the patient will also have impairment of the B cell and the T cell function. So B cell and T cell number will be kind of normal range, but the function of the B cell and T cell will be abnormal. And if we do the liver function test, the liver function tests are often impaired. So those are the high yield points about Felty syndrome. If we summarize the findings, Felty syndrome is a complication of rheumatoid arthritis. What type of rheumatoid arthritis? The patients who are older, who had rheumatoid arthritis for a long time. So a female older patient who had RA for a long time that resulted in deformity, and the patient is also RF positive. Those are the risk factors. What are the features? The patient will have hyperactivity and proliferation of the reticuloendothelial system. So there will be hypersplenism. So spleen will be large and there will be lymphadenopathy. And there will also be the additional features of RA, long-standing RA, such as vasculitis resulting in ulcer, subcutaneous nodule, and recurrent infection due to a decrease in cell counts and impaired function of the B and T cell. Investigations finding will be pancytopenia, abnormal LFT, and decrease in the functionality of the B and T cells.